The human wrist is an amazing complex joint, by way of construction as well as function. Dr. Andrew Wong of Redlands Community Hospital describes the wrist in detail and the problems that can occur with the wrist.
The wrist is a very complex joint. It's an amazing joint because it allows for us to really manipulate our hands into extreme motions. But the wrist is also very delicate. It's made up of some ligaments that connect these bones, and with disruption of any of these ligaments can cause problems down the road, including disabling pain or arthritis. Surrounding all those deep structures of bones and joints inside our wrist, we also have a very intricate system of tendons that go around our wrist. And that's what powers our wrist to flex and extend, and also helps us power our fingers as we use them for everyday activity. Oftentimes what I'll see is tendinitis that presents. These patients can come in from just some mild aching or swelling, all the way in spectrum up to people who come in with very disabling pain. There can also be repetitive or cumulative trauma kind of injuries to our wrist. Those include arthritis, where the joints in our wrist can wear out over time. And those also include some damage to some of the ligaments that live inside our wrist. Specifically on the ulnar side of the wrist, or on the small finger side of the wrist, there's a very strong ligament that holds the distal radial ulnar joint together. However, when we do activities that are heavy torquing or twisting type activities, or do any kind of heavy hammering activities, that little ligament can get pinched, rubbed on, it can tear and wear out. So that can also cause quite a bit of pain. They'll get a popping or a catching type pain in the wrist, and that's something that really helps me to hone in on that part of the wrist as maybe being a problem. We all have cartilage in our wrist, and as we go through our lives, we may get wear and tear, so there may be a flap of cartilage that gets caught that can cause some cracking. When we fall, we usually hit the ground with quite a bit of force, and we break our fall with our hand outstretched. And so, sure, some of these activities that we do sporting-wise, it's really our wrist that takes quite a bit of that injury. The wrist tendons can snap or pop with forceful activities such as throwing or swinging a bat. So that is quite a common thing.
Dr. Wong explained the treatment for certain problems of the wrist.
For the most part, these wrist tendon-type injuries resolve themselves. In general, I like to treat patients at least 6 to 12 months with various modalities that don't involve, injections or surgery. And usually during that time period, patients can get quite a bit of improvement. There are some very non-invasive or minimally invasive ways that we can look inside the wrist. There's wrist arthroscopy. So if we're worried about a specific tendon or a ligament being injured, we can often make small poke holes on the back of the wrist. We can blow the wrist up with fluid on the inside, and we can really push away some of these structures and get a really good look at what's going on deep inside the wrist. When we sit in front of a computer screen, for example, we really should have our back well supported. The computer screen should be across from our eyes, about 18 to 24 inches away. Our shoulders should be relaxed. Our elbows, our hips should be positioned at about 90 degrees. And then that holds our wrists at a pretty straight position. So really that eliminates a lot of that very extreme positioning that can pinch the median nerve within the carpal tunnel. So that's one simple way I think that we can all concentrate on to try and decrease the amount of pressure that our carpal tunnel puts on our median nerve. We know a lot more about ways that patients can avoid these kind of injuries at work, and we have other ways of treating them with specific bracing, different kind of medications, and different kind of ways of changing their activities as well. So I think we've gotten quite good at treating wrist pain.